49, we added appointments by the Lieutenant Governor and the Speaker. There was a question on the reimbursement, and we added language that on line 85 to suggest that the reimbursement would be pursuant to OPB's guidelines, which is what all the other councils and committees and so forth are using. And we also, at the very end of the bill, put language under that Code 17 section, again, just to make sure everybody understood and clarified about the reimbursement, that we're following current policy.
The line on that, Senator?
Oh, I'm sorry, it's the last line of the bill, 325. Well, third from the last line.
Did you find it?
Now, there was some discussion and oversight on my part. I think it could have been the committee's recommendation, desire for a dentist to be specifically named, and I certainly don't have any objection if y'all want to add that line to this. That was an oversight on my part.
Okay, I don't think we had such a big audience at the last meeting when we went over this bill, almost line by line. So I will take questions from the committee now on the substitutes. Okay, Representative Pruitt.
I just wanted to reiterate the fact that I think we wanted to have, because we have such a issue with so many places in rural Georgia without dentists, that dentists be included, and I can see that that was not done.
Okay, we have an amendment to that issue. Representative Silcox.
Yes, at the appropriate time, I'd like to offer an amendment.
Okay, hold on. Do we have other questions? Who's Tim? What? Representative Jaspers.
Thank you, Madam Chairman. I'd just like to make really more make a comment than anything. I just want to commend Legislative Council. In the last, I've got a bill, Rural Development Council bill, and Senator Burke's bill, and with two Legislative Council people working extremely hard to meet our needs. And I'd just like to take a minute to thank Betsy over here, and Lynn, and just working on the Senate bill for their work. It takes a lot just to try to get all of it in such a short amount of time. And I hope Senator Burke probably agrees with me that we just really appreciate a complex bill like these with the work that they've done.
Well,
and I
would
thank
like
you, Betsy.
to echo that if you
Same.
don't mind, and would also like to say that these two bills have been worked on for months, and a delicate balance is in effect in trying to make sure that the House and the Senate improve health care in Georgia as a whole, but especially in rural health care. And I appreciate this committee's attention to that very important issue. So thank you.
Well, and Representative Jaspers, thank you for that. And I think, is Lynn not retiring this year? She is. So
She might be after this.
Yeah.
is she here?
She might quit tomorrow. I don't know.
No. So, we do appreciate all her efforts, but I've always said that we have the best counselor and the best lawyer of all. Betsy knows healthcare and is always responsive to our needs. And for some reason, the Legislative Council has been worked and overworked this session, and they work weekends and nights. And I know I'm very appreciative, and I'm sure the committee is. Shall we give her a hand, everybody, to Betsy and Lynn? And she's probably, I do try to be nice to her, but she probably would like to forego all the funky earrings I bring her from around the world. So anyway, sometimes I'm sure she looks at me like, what is this? So, but there's no way we can show our appreciation enough, Betsy, for everything you do for us. So I will thank you. Okay, who's number 16? Representative Barr.
Thank you, Madam Chair. To the author, appreciate all the work you've done on this.
Where is he?
I do have a question, line 108, just in concern about perhaps how big this may become. You know, to try to, all these members and these folks that many of them are already on a payroll here. I just have concern that we're creating something that we're not perhaps have a cap on. Do you have any idea of how many employees, professionals, technical and clerical personnel it may be necessary to hire in these roles? I have great concern about leaving this open-ended.
Well, I'll make two comments. One is, keep in mind that 20%, 5% of our current budget is spent on health care. And for us to spend some money to try to get a handle on that, I think is a very wise investment of our taxpayer dollars. I certainly don't want to put a cap on it, because I think that that just handcuffs people that need to be making the decisions. I think each agency itself has expertise and staff that can be utilized to try to minimize any additional or new personnel. I think that the whole purpose of the council is to try to work with all across the agencies to develop task forces and new ways of looking at these issues, and there's no reason at all for us to be hiring people if those people already exist, whether it's in DCH or public health or health and human services, wherever. So again, I understand your concerns. I'm fairly confident that, and from the knowledge that I've gained with the governor we have now and future governors, that they're not going to be wasting the taxpayers' money on these issues. But I'm very hesitant to put a firm cap on it.
Thank you.
Representative Barr, do you have a suggestion? I mean, you want to put legislative approval or anything like that? I'm not suggesting it. I'm just asking, did you
Sure.
have
You know, I tried to look at this over the last couple of days. Is there something similar somewhere? And did not come up with a firm number. No, ma'am.
okay, Betsy, is there any?
Well, if you look on page 5 on line 129, it talks about the council will prepare a budget request. So the money they have is gonna be based on whatever appropriations they
Right.
get, or on line 132 if they get any kind of donation. So they're gonna be restricted by that from a practical
Well,
perspective.
Because they'll go through the budget process, right, just like anybody else, and open for review. Okay. Thank you.
Thank you, Betsy.
Representative Hawkins, you got a question?
Oh, well, I did, and I assume that you've got on your side of the budget, budgetary planning for this.
I have some ideas that I will be sharing with the leadership when they ask. Yes, sir. Thank you.
You mean y'all aren't through with the budget yet? Are y'all gonna be holding us up?
When did y'all pass the budget?
I think it's laying on our desk as of yesterday afternoon.
I think Senator Hill is anxious to get at it when y'all give it to him.
Okay. Representative Pruitt.
Thank you, Madam Chair. I just want to make a comment that when they report back to us next year, that will include the cost, I'm assuming, at that time, and we'll have an opportunity then to make
I would certainly
adjustments.
ask for it. If they don't give it to us, we can,
I'm sure it'll be in the amended budget.
in the
Madam
amended
Chair.
budget. Thank you. Okay, there's no further questions. Is there anyone in the audience that signed up to speak for the bill? No? What? Oh, okay. Anybody? Is it Sherry Ackerman? Oh, there you go. You'll tell us your name again for the microphone and who you're with.
Hi, Madam Chairman and committee. I am Sherry
You
Ackerman.
need to
with
pull the mic down where we can hear you.
Sorry.
Thank you,
Thank
sorry.
you, Madam Chairman and committee. I'm Sherry Ackerman, and I am with Hometown Help, and we work with about 45 rural hospitals in Georgia. We appreciate the opportunity to offer support for this bill and all the work by the authors. Jimmy Lewis apologizes for not being here to verbally support this bill. He is at a historic groundbreaking for a replacement hospital in Cook County, Georgia, Tift Regional Adel campus.
Okay.
So again, we support and we thank the authors for all the hard work that's gone into its development.
Okay, thank you very much. Okay, all right. What's the committee's posture? Okay, Representative Silcox. I have a motion to do pass and a second. Is there any further discussion about the main bill? Okay, I'll be recognized now for amendments. Do you have an amendment, Representative Silcox?
Yes, I'd like to make a friendly amendment, and at lines 56 and 57, add, instead of just restricting it to primary care physician, I'd just like to say 2 practicing physicians and 1 practicing dentist.
On 56 and 57?
So are you adding, you're adding 2 more to the number there?
Yes.
So we'll have to change.
Oh, I'm sorry, yes, you're
How
correct.
about this
Okay.
idea? Oh, can I speak? I'm sorry.
Yeah, you can, Representative Hawkins.
How about if we add 1 practicing dentist, which would be B, C, 1 practicing pharmacist, and I add pharmacist because they're so vitally important, as we know, in the process of healthcare. And so many things have been happening in their area of delivering the right drugs for the right reasons to the right patients.
Have you been talking to the pharmacy cartel that we have in the
I've been
house?
listening to you. No, I have not. I've been listening to you.
We're gonna lose people.
Yeah.
Some people are running again, and the pharmacy cartel's gonna go down. There'll only be one or, from what, 5 or 2? 3? Okay, I mean, I don't know what y'all were thinking. Okay,
So-
all right, go ahead.
And just think about this, because I know you and I have not had a chance to speak, but B would be practicing, 1 practicing dentist, C would be practicing pharmacist, and then change C to D, and there would be 1 primary care physician. But
That's
you-
fine.
Is that okay?
Yeah, I guess I wanted to open it up to any physician, just because I know the demand on the primary care guys is huge.
So you're really sort
Oh.
of basically withdrawing or changing yours, okay, sort of informal. Do you want to read that again and make it
Yeah, because
informal?
that will not change the overall number.
Go at it again for
Okay,
me.
so the amendment would be B, change B to 1 practicing dentist, a new C, practicing, 1 practicing pharmacist, and D, change C to D, 1 practicing primary care physician.
You got it,
In
Betsy?
other words, we would strike B, the language B on line 55, and insert B, 1 practicing dentist, C, a new C, 1 practicing pharmacist, and change C to D, 1 practicing primary care physician.
Okay,
Okay?
right. Do we have any discussion? I think we do on Representative Barr.
I
You
was going
wait.
to offer an amendment at a proper time.
You want to offer it? Okay. All right. Representative Price, you had on this discussion?
Yes, thank you, Madam Chairman. I'm wondering, by eliminating B, if that's eliminating a segment that was deemed important to be part of this body. If Dr. Burke would care to respond.
Thank you for the question. This group of council representatives made up a huge amount of effort and time to try to strike a proper balance. And I can promise you, after you get through with this today, you will have other people that feel like you could have done better.
But they don't get to vote. I'm
I
just
mean, the
being
ones
smart.
even that vote
Okay.
will have that opinion.
Oh, okay.
And so, if you're asking, would I prefer to leave it as it is, that would be my preference, because again, the amount of work that we put in it. Is the council itself important enough that I will gracefully accept whatever changes this committee makes? Obviously, that's my plan.
Okay. Well, we have an amendment before us. What, do I Who? Oh, Representative Drenner. Sorry.
I just wanted to, and I can imagine what you've had to go through to get some agreements between all of these groups just by looking on section 31-53-11. And I'm just offering that perhaps instead of adding a member, additionally, maybe we would just say somewhere in that section that any of the commissions or councils, et cetera, that have to do with healthcare would provide their reports into this council instead of, you know.
And that actually is
That's actually in
the
there.
That's in
bill.
there? Okay, I apologize, I did not
Starts
see
on
that.
line 191.
Okay, I'm
So you
sorry.
hadn't had a chance to read the sub.
No, I stopped at the list.
Is that okay? Answer your question? Is that all right? Okay, we have an amendment. You've heard the discussion. We have an amendment for it. Do I have a movement on the amendment? So moved. Do I have a second? Second. Movement second. Okay. Everyone that is in favor of the amendment is read by Representative Hawkins. Say aye. Aye. Anyone opposed? No.
No.
Okay, I think the ayes have it. So that amendment will stand. Okay, now we're back. Okay, do 16. Representative Barr, sorry. You have an amendment?
Yes, ma'am. Thank you, Madam Chair. In regards to my concern, on line 77,
77.
if we could add 3 words, preceding annual,
Hey, guys.
insert, including annual expenditures.
Okay, on line 77, after the word detail,
I'm sorry, after report.
oh, after report, sorry.
That's right. After report, including annual expenditures. And that way, we could just kind of be able to track. And they may put that in the report, but it's not necessarily in here at this point. So that would be a safe way for us to be able to look at that.
Okay, does everybody have it? All right, any discussion? All right, everyone in favor of the amendment as recommended by Representative Barr, say aye. Aye. Anyone opposed? No. All right, the ayes have it. Thank you. Okay, now we're back to the posture of the passing a substitute to the substitute to 3B, 357. Everyone in favor of the passage, say aye.
Aye.
Everyone, oh, okay, wait a minute. Representative Newton, you get in late?
I'm sorry.
Go ahead.
Just, could you ask, just if you don't mind, on line 90, if I might, talking about the director, there were some exclusions from what they could, how they were chosen. Is that a full-time position of this director that reports to, or is that a part-time position, or is it
I guess it's not specified, but I mean, I think this would be more than a full-time job for at
like
least
you
a
said,
couple
20% of our, okay, thank you.
Yes.
Okay, that answered your question? No amendment or anything? Okay. All right, we're back in the posture. Let's start over again. Everyone in favor of the passage of substitute to Senate Bill 357 as amended, and it will go out as a House substitute, say aye. Aye. Anyone opposed? No. Okay, the ayes have it. Thank you very much, Senator.
Thank you.
Okay, which one got next? Okay, Senator Martin, I'm going to call it Senate Bill 382. That is in your folder, LC 372614. And then, welcome, Senator.
Thank you, Madam
Hope
Chair.
you're feeling better.
Much better.
I'm
Thank
working
you.
on my froggy voice.
I appreciate you giving me another chance to come in and cancel on short notice for
That was okay.
my benefit, and for your benefit, I promise.
Okay, go ahead.
Committee members, Madam Chair, thank you. I'm here to present SB 382. This is the codification of Governor Deal's executive order with regards to the Optom bill that we passed last year. It deals with training procedures for setting up the approval of training for the new procedure that we approved. And this has been we've gone through a lot of discussion with many of the people that dealt with this issue last year. I believe that all parties are in agreement, and I would ask for your favorable consideration. And I can go in a little further if you want me, a little deeper if you want me to.
Okay. Are there questions from the committee? Representative Peasel.
Thank you, Madam Chair. At the appropriate time, I'd like to make a motion.
Okay. Do we have any questions? Okay. No. Does anyone, Aubrey? I would suggest you just stand up and say you're in favor of it.
Madam Chair, we support the language of this bill. It's a codification of the executive order, so we support the language.
Well, let's see. I thought that there was talk at one time, or the agreement had been that it would be with the medical board. Was that not correct?
That would be illegal under the Constitution, the decision of North Carolina Board of Dental Examiners versus FTC, which came out in 2016. And I believe the governor's office passed a bill 952 to straighten that out, where a competitor cannot be making rules or having final sign-off on another competitor's profession.
Okay.
That's why in their wisdom, I think they did not go that way, and we support this language.
Okay, just wanted to make it clear. And you can get me a copy of that ruling, just so I'll know for future reference. Okay, thank you. All right, we're in the posture. What do we want to do about the bill?
Move to pass?
Got a move to do pass. Thank you, Representative Peasel.
Second.
We've got a second. Is there any further discussion? Okay, everybody in favor of the passage of Senate Bill 382, say anyone opposed, say no. Well, the ayes have it. Thank you, Senator.
Thank you. Trey Rhodes will be carrying that, Madam Chair. Thank you
Okay.
very much.
Wait a minute, who's carrying it?
Trey Rhodes,
Okay, thank you.
thank you.
Okay, I added one to the agenda today, and that's my House resolution. Okay, 1292. This is about Alzheimer's. Well, I see the nursing students are leaving when the one that might have even affect y'all would come up on Alzheimer's. Okay. And the next time you come to my committee when there's this meeting, I would suggest that you wait until it's over to have this many people go out. It's a little bit disruptive. Are they nursing students? Was I wrong? Are they nursing students? What? What kind of students are you? Somebody ask them. Nursing? Okay. Huh? Not, I didn't say that. Okay, are we back to quiet? There's now seats for everybody. Okay, this is about Alzheimer's. I mean, you've heard me say over and over that, you know, Alzheimer's is on the rise across our country and in our state. We are an aging state. Now, when you reach the age of 85, 1 out of every 2 people will suffer from Alzheimer's, or, you know, in varying degrees. In fact, if we don't get diabetes and Alzheimer's under control, it will bankrupt the country. We are concerned because with the increasing number of Georgia residents that are living to be over 85, there needs to be more places for them to live. As our newest member, Representative LaHood probably knows, these are difficult patients to take care of. And as they progress with the illness, it's a bigger skill needed to take care of them. It's more costly for our nursing homes and if they're going to be in their homes for the caretakers. So I think this is urging the Georgia Alzheimer's and Related Dementia Advisory Council to look at this and to sort of map out a plan where Georgia can get better prepared, that we're going to have, you know, access to good quality long-term care for our citizens, and that we look at how much it costs so the people that are responsible for, you know, taking care of them in the institutions get more adequate reimbursement. I will tell you, even with our nursing homes, and I am very proud of the fact that there is money going into the budget this year to increase our nursing home facilities for the jobs they do. Nobody's perfect, but we take care of thousands of patients across our state, and on especially Medicaid and Medicare, and I am appreciative of the jobs they do. We can always improve, and they say the health of a nation is how you take care of your more vulnerable citizens, and that would be our children and our elderly. We've worked a lot on our children, and now we're working on our elderly. Okay, Representative Drenner.
Madam Chair, I need to go to another committee meeting, and I don't want to be included in the students that just left. So I would like, at the appropriate time, make a motion, be recognized for a motion regarding this.
I will do that, and
I'm in her class as well, Madam
we had a motion and a second. Anybody dare make any discussion on that? Okay, I got a motion and a second on the passage of House Resolution 1292. Everybody say aye. Aye. Anyone opposed, no? Okay, ayes have got it. Run. Thank you all for coming. We're adjourned. Thank you, everyone.